Good morning, Tom. So today you are several months after your surgery that we did on your left foot.
Right.
And basically your story is that you're a diabetic and you
Right.
developed a sore on your second toe, and it was an ulcer.
Right.
And we had a very hard time healing it because the toe was so contracted, it was so deformed that it was touching the bottom of the shoe.
Yeah, created a hammer toe.
It was it was a hammer toe, and the end of the toe always had an ulcer, an open wound.
Right.
And we tried all the traditional ways to try to heal it up, and every time it would close down, the pressure from the shoe would reopen the wound.
Exactly.
And remember how you were on antibiotics many times.
Just about all last year.
Right, exactly. And we tried and tried because obviously you being a diabetic and having foot problems in the past, we were both very hesitant to do the surgery on you.
Right.
But I think at the end, both you and I were kind of like, if we don't do something, it will eventually travel to the bone.
Right.
So I performed a very simple procedure, and we did it in the office. And I cut the tendon on the bottom of your toe, and the toe is not a hammer toe anymore.
Nope. Sure.
So basically now today, 2 months after the surgery, there's no more open wound.
No, everything's healed up fine.
Okay, and so for people who are sort of in your situation that have an open wound or diabetics and they don't really want to have surgery, what would you recommend?
I would recommend that they would go ahead and take your advice and do the operation. There was no pain. It took maybe 15-20 minutes at the most to do here in the office, and I've had no problems with it since then. It healed up fine.
Right, and remember how I told you, Tom, remember we're sitting on a time bomb here.
Yeah.
It's eventually going to go to the bone sooner or later. And you and I, we know that once it goes to the bone, even if you take the infected bone out, you have to stay in the hospital sometimes for about 6 weeks.
Yeah.
So I think it's a very good lesson both you and I learned, that sometimes being a little bit on the aggressive side really pays off long term.
Oh yeah, I have no regrets of doing it whatsoever.
Okay, well thank you so much for taking your time.